Bacterial meningitis is a medical emergency, and if you suspect that your child may have bacterial meningitis, it's imperative that you try and seek medical attention as soon as possible. The point of this video is to go through some of the signs and symptoms of bacterial meningitis in children, and also comparing younger children to older children, and also to inform you about what causes meningitis and a related condition called meningococcal septicaemia. And we hope that by doing this we'll empower you as parents to be able to be on the lookout for any signs or symptoms of these devastating conditions, so that you can act promptly if you feel that your child may be being affected by these conditions. Meningitis is different to meningococcal sepsis or septicaemia. Meningitis actually describes an inflammation or infection of a part of the body that is the lining of the brain and spinal cord. This tissue is called the leptomeninges, and that's where the name meningitis actually is derived from. But a lot of people confuse meningitis with meningococcal septicaemia or sepsis. Sepsis or septicaemia is when you have bacteria growing within the bloodstream, and which can then grow in other tissues as well. And this condition overlaps with meningitis because one of the organisms in particular can cause both of these conditions. And indeed the two conditions can lie hand in hand with each other. And so, for example, you would have a child who may present initially with symptoms of meningitis, who then goes on to have septicaemia. Now, we're going to go through the organisms that cause these two main conditions and some of the signs and symptoms. So, meningitis and septicaemia can be caused by four main types of organisms, and you'll be able to read about those organisms on the article that we have on this website at the Children's Hospital. The peak incidence is under 2 months of age, and that's very important to note because a child at that age is not able to tell you that they're unwell, so we're dependent upon your instincts as parents and also certain signs and symptoms that can help give us clues that this child is unwell. And we need those to be highlighted and picked up on so that you can act to protect and manage your child effectively. Symptoms usually start with an upper respiratory infection, and by that all I mean are symptoms like a common cold. So there might be coughing, sneezing, and there might be secretions that come from the nasal passages. The vast majority of cases will then progress very rapidly, but there are situations where the course of the disease is slightly more prolonged and may occur over a day or two. Either way, it's important to pick up on the symptoms and signs and act on them appropriately. So infants or babies may present with a number of different signs and symptoms, and this may be something as simple as poor feeding, and in fact poor feeding is usually the first sign that something is wrong in a baby. High fever or even low fever. So a child typically or classically is described as being infectious or infected when they have a high fever. But actually in younger children and babies in particular, we know that sometimes when a baby has an infection, the temperature can actually be low. It's really important that you have a way of measuring temperature effectively. We don't put a lot of emphasis as paediatricians on the forehead strips, but there are other easy methods of measuring temperature, including devices which can measure the temperature through the ear, and it's important that you learn to use the equipment that you have available to assess your child when they're well rather than wait for when they're unwell. Other signs and symptoms include rapid breathing, and this is because this reflects the acid-base status of the child's in the child's bloodstream. So this is an important feature to look out for. Irritability reflects the fact that the meninges may be inflamed or infected, as does restlessness. A child may, however, just present with relatively innocuous features such as vomiting and diarrhea. However, if the central nervous system has been affected, then seizures may be present. A bulging fontanelle, the fontanelle is the area or the soft spot on the head of the baby, which is open until about 18 months of age, is a sign that there is an active process going on and increased pressure within the central nervous system. And of course, the vast majority of people will be aware of the fact that a rash or spots may indicate the presence of meningococcal disease or meningitis. It's really important to note, however, that in a lot of cases the rash or spots are a late sign, or indeed may not occur at all. So I know that a lot of emphasis has been placed on the glass test in the UK, and this is a very useful test if you see a spot to give you an indication as to whether or not a spot is blanching or non-blanching, and that simply describes whether it disappears or not when you press on it. However, we have to think about all the other signs and symptoms in addition to the rash, because as I've already said, the rash may not occur at all or may be a late sign. In older children, symptoms can be slightly different. A child can present with fever or headache, a dislike of the light, vomiting, confusion, irritability, and of course one of the cardinal signs, which is neck stiffness. But actually neck stiffness can occur in only up to 40% of patients. So it's important to take all of these signs and symptoms together, and if you have any suspicion at all, to act on them. So I have to emphasise again that if you feel that your child may have symptoms or signs of meningitis, that you act upon it quickly and seek medical help. Now, we have a number of resources, such as the resource for meningitis and meningococcal septicaemia on the Children's eHospital website. If there's anything that you are unsure about or that you wish to discuss, you can contact us through our eHospital website, and the address will be at the bottom of this video. Thank you.